to the history of our department, and we'll learn a little bit more fun facts with our fearless leaders. We have our chair, Dr. Barbara Young, and our vice chair of finance administration, Betsy Buswell. And I believe Dr. Young will be kicking us off.
Yes, thank you. And yeah, there will be the answer to that trivia question. So want to welcome you all. We started this because, as you know, this is a big place, lots of people, lots of different places, and we're finding ourselves in the midst of COVID, and there was just sort of a feeling, how do people connect to what this place is? We saw where everybody's coming from. So just give an opportunity to get sort of a very broad picture overview of who we are, what the department is, where to turn to. And it's a work in progress. So we want to hear how this went. But most importantly, please all feel welcome, and feel free to reach out to any of us with any questions you may have after this. So next slide, please. So here we go. So these are the early years, 1877. So here is King County Welfare Hospital opened, which then later became Harborview Medical Center, which was not the UW at the time. 1946, School of Medicine was established, and then the department 2 years later. And then we had a VA hospital affiliation in the 50s, and the University Hospital that's here now opened in 1959. And here you see the original home of the Department of Medicine, which was a recycled army barrack, as you can tell. Next slide, please. So the history of the chairs, it started out, it's actually very interesting. When I went back and looked at some of the history, when Dr. Williams was chair, it was the time where basically you were designated to a specialty. So he found a person who seemed to be interested in GI and said, you know what, you'll be our gastroenterologist. And then there was a person who liked to auscultate, and he became the cardiology division head. So we've really evolved from that to a lot of specialization. Dr. Fialco, who you see here, was chair and then later dean. And in fact, when I first moved into my office, we had his furniture here still, so we don't throw things away easily. Dr. Petersdorf, who you see on the upper right side, you will see under my signature, I hold the Petersdorf Endowed Chair, so he was a larger than life figure. You see Dr. Paul Ramsey on here, who is our current dean and CEO, and Dr. Bremner, who led the department for 20 years before I was fortunate to be allowed to take over. So next slide, please. We have amazing faculty. We just listed a couple of the really outstanding awards that have happened. And here you see Nobel Prize being given to one of the UW faculty members. Next slide, please. We also have amazing staff. And we wanted to call out some of the distinguished staff awards that we've had many nominees for over the last couple of years. Next slide, please. This is our mascot here, the Husky. Department mission, we just put the slide up to anchor us in what we're here for: discovery, teaching, healing, and diversity, and not in that order necessarily. Next slide, please. So around that, we just recently embarked on a departmental strategic plan and looking at the road ahead. And this was a plan prior to COVID. And then in the midst of COVID, we started thinking, should we even do this now? You know, there's so much else happening. There's so much change. And in many ways, it seemed like the worst of time to start thinking about the future. But in many ways, it was the best of time because there's an exciting road ahead, so much changes in the air. And we're very proud to start presenting some of the product. We're actually in the midst of finalizing that plan. There are 4 pillars which really resonate with the slide that you saw previously and build upon it. One pillar is to lead in innovative research, clinical care, and education. This will only be possible if we can nurture a supportive, collaborative culture where equity, diversity, and inclusion are at the center. So we didn't want equity and diversity to be an afterthought, but a pillar of what we do. And for this, we need to invest in our trainees, staff, and faculty, and all 3 equally and at the center of what we do. And this will allow us also to elevate and sustain our teaching mission, which is so important to us. Next slide, please. So I just want to direct you to some of the many web pages that we have. Go check out the diversity one that we have. There's lots of activities up there. We have a mission, and you can see on the right-hand side all the different councils we have. We have a diversity council. We have an LGBTQ plus medicine council. We have a gender equity council. So we're doing a lot of work in that space, and we want to be really disciplined and outcomes oriented. Next slide. Well, and with this, we're getting to the fun pieces of like, how does all this fit together? And I'm going to hand it over to my fearless co-leader, Betsy. Betsy.
And I want to echo what Dr. Young said and welcome everyone. We're thrilled to have you in the department. As was mentioned earlier, I'm the new Vice Chair of Finance and Administration for the department and have been with the department for almost 7 years, but in this new role for only a couple of months. So I hope I have the opportunity to interact with all of you going forward. So with this slide, we wanted to give you an idea of where we sit in the broader University of Washington picture. So you can see in the gray box at the center, we've got the Executive Office of the University, which includes the President and Provost and Executive Vice President. And all of these larger boxes below all report up to those entities. So specifically areas that would affect us are the bottom box looking at the colleges and schools within the university. We're starred as part of the School of Medicine. Also notably in the top right corner, there's a mention of the CEO of UW Medicine, the Executive Vice President for Medical Affairs and Dean, which as Dr. Young mentioned is Dr. Ramsey. Next slide. So drilling down a little bit more about where we fit within the School of Medicine. On the left, Department of Medicine with our 13 divisions, and there are 31 other School of Medicine departments, a mix of basic science and clinical. Next slide. These are our 13 divisions, and everyone, most people I would think on this meeting are within one of our divisions. So there's also a note of emergency medicine, which became its own department in 2017, but used to reside in our department. Next slide. This is a layout of the department leadership, Dr. Young and I on the left-hand side, and then I'll walk through some of our vice and associate chairs. Dr. Annawalt at the top is one of the vice chairs and the service chief of UW Medical Center, which includes both Montlake and Northwest locations. Dr. Harrington is our vice chair and service chief at Harborview Medical Center. Rudy Rodriguez is our vice chair and service chief at the VA. And a little bit later, we'll get into some of our clinical locations. Dr. Pa is the director of our medical student programs, and Ken Steinberg is the director of our residency program. And you'll see a little bit later, these are large programs spanning the whole department. Dr. Gallagher is our associate chair for patient care quality, safety, and value, and he's been instrumental in the strategic plan process that Dr. Young mentioned earlier. Dr. Lyles is our associate chair for research, and Dr. Dan Cabrera is serving as our interim associate chair for diversity and inclusion. And then we'll get to the next slide, which is our division heads. So you can run through all these names, but these are the heads of each of our 13 divisions, and we have a number of interim roles right now, so plenty of recruiting going on. Next slide. As far as our divisions, there are also our division administrators, and the divisions are run in dyad pairs. So these are the business managers of each division, and we are currently recruiting for a cardiology administrator. Next slide. This is a quick snapshot of who makes up our department. So as you can see, over 1,200 paid faculty. We have 376 ACGME residents and fellows, and 77 non-ACGME fellows, which are individuals in a training program, but typically not completing a program that will lead to sitting for boards. We have over 1,000 non-paid faculty, plenty of which are in the 5-state WWAMI region and contribute to clinical and educational missions of our department. And as you can see, we have over 900 staff members and 70 adjunct faculty. As far as our student program, 65% of our third-year students in our internal medicine clerkship rotate in both Seattle and in the WWAMI area. So that's Washington, Wyoming, Alaska, Montana, and Idaho. So a 5-state region that we're involved in education and clinical care throughout. Next slide. Our residency program mentioned earlier, Dr. Ken Steinberg is the director of that program. I'll actually start on the right-hand side. So we have, for our internal medicine program, we have sites here in Washington, but we also have international opportunity in Kenya. In addition, we have residency programs, internal medicine located in Boise, and dermatology, medical genetics, and occupational and environmental medicine. Next slide. Research and centers, as was mentioned with our strategic plan, discovery is at the heart of the work we do and what we're focusing on going forward. So as you can see, we have 894 research awards from both government and private sources, a very large amount of space for research, and a number of recently established centers. Next slide. Clinical activity, over 400,000 outpatient encounters and 350,000 inpatient encounters. And we have so many clinics and hospitals at which we do work, including the UW Medical Center, both at Montlake and Northwest, Harborview, the VA Puget Sound, and Valley Medical. In addition, we have faculty going to Seattle Children's Hospital and plenty of work with the Seattle Cancer Care Alliance and the Fred Hutchinson Cancer Research Center. We also have satellite clinics at locations such as Bellevue, Edmonds, and Everett, and a whole network of UW neighborhood clinics. And as you can see on the map, this is just to give you an idea of the dispersion of our hospitals. So up north, we have UW Medical Center Northwest, and at the very far south, the VA Puget Sound. Many of us are located in the center at Montlake, including Dr. Young and I, and then we have activity both in downtown Seattle at Harborview, South Lake Union with Seattle Cancer Care Alliance, and then up near Laurelhurst with Seattle Children's. And with that, I think I'll hand it back over to Bryn. Thank you.
Thank you, Betsy. So now we'll tell you a little bit more about our central teams, starting with Quan Tan in finance as the Director of Finance. Take it away, Quan.
Thank you, Bean. Yes, actually, Serena was supposed to be presenting this for the team, but unfortunately, she's not available today. So I'm helping her to just kick it off. So as you can see, Serena Francisco is our CFO. She's reporting to Bessie Buswell, and then I report to her, and then these are my team. We have really program operation analyst. We have Cam Lee, she just joined us last month. And we have Lisa Building, she's a clinical program analyst. Edna Ramos is program operation analyst. Cynthia, budget analyst, and Mari, fiscal specialist. And next, Krista is reporting, she's the director of business and planning. She's also reporting to Serena, and those below are reporting to her. We have Sam Caldwell, agreement manager, Kelly Perry-John, manager, and clinical operations. Karina, she's a fiscal specialist, and she will be leaving us in a month or so to become law students at UW. So I'm so excited for her. And Ed Doe is the data strategist, and we have Joy, the revenue cycle manager, and Tom Riley. I think his name is spelled R-E-I-L-Y. Anyway, he was he's a doctor, but he's so good with data. Now he's working with our clinical team to work directly with the UWP about the clinical billings. And then we have Sui, the revenue cycle manager. So this is what we are doing in the finance services, provide guidance and navigating and understanding the university policy, budgeting and financial planning and analysis, and financial reporting, payroll, as well as compensations. In addition, we also do purchasing, travel, and expense reimbursements. As you can see, like we do day-to-day management for faculty, for payroll and compensation functions, budgeting, financial reporting, the DOM IT billing and invoicing, clinical contract, service agreement, and other agreements. We also review recharge and service central rate proposal. In addition, we also doing for the trust office, we're doing all the expense reimbursements, reconciliation, and other related services. as well as business planning and development and clinical revenue cycle management and hospital funding. So this is our team. If you have any question related to payroll or on any of these topics, please feel free to reach out to us.
Thank you, Kwan.
Thank you.
Okay, up next we have academic human resources, and we have 3 team members presenting. We have Shoshana Haig, Administrator of Program Operations, Ksenia Sava, Program Operations Specialist, and Anna Lim, Program Operations Specialist.
Thanks, Bryn. So our team manages the academic human resources part of our department. We're really the central resource for any faculty, the searches, the recruitments, hiring, new appointments, reappointments, promotion, and tenure. We mostly assist the divisions in this activity. So we encourage those faculty members to really work with the divisions directly, but we are always available to assist you and be a resource for you. We also provide guidance in navigating and understanding the faculty code, which is what governs the organization and functioning of the UW faculty. So next slide, please. So this is our team. Karen is our academic HR director. She's retiring soon, so that's why we're presenting here in sort of her place to give the rest of us a chance to meet all of you. So I'm Shoshana Haig. I'm the Administrator of Program Operations. I manage the regular and research faculty programs in the department. So all the recruitment for that faculty, the promotions, appointments, and reappointments for those groups. And I also manage the merit process. Heidi Williams is a program operations specialist on our team. She manages the paid clinical faculty, recruitments, appointments, promotions, reappointments, and also our teaching associate programs. I'll pass this over to Ksenia, who can introduce herself and talk a little bit about what she does.
Hello, everyone. Thank you so much, Shoshana, for introduction. And my name is Ksenia Sava, and I manage acting appointments and fellow appointments in the Department of Medicine. We've recently hired a new person to our team, Celia Chor, and she's been helping me with appointments for fellows and acting instructor and acting faculty. In my role, I also manage visas for faculty and trainees, and also faculty leaves and some other processes that are related to FTEs of faculty. If you have ever questions about, your leave or benefits, well, not necessarily benefits, sorry, benefits in terms of your leave and your FTE and stuff, feel free to reach out to us. And I'm going to pass it over to Anna Lim, who is one of our colleagues as well.
Hello, I'm Anna, and I manage the volunteer clinical and affiliate faculty program. So I manage the appointments, promotions, reappointments, and anything else related to those faculty programs. And I also support Shoshana with regular annual processes. And next slide, please.
Okay, back to me. So this is my area, staff HR. Here I'm with Chrissy, our HR administrator. For staff HR, we partner with the divisions and campus HR on areas including staff employment, compensation, leaves of absences, and employee and labor relations. And then next slide, please, Angie. So here's an overview of our conflict resolution resources. It gives you an idea of how we navigate and resolve conflict in the department and also within the larger university. There are local resolution resources, which include your direct supervisor, your division administrator or HR manager, and department HR, which would be myself and Chrissy. We also have a campus HR consultant that works directly with our department. Her name is Joanne Wutschik. For other university resources, there's the Office of the Ombud, the University Complaint Investigation and Resolution Office, or USURO for short. They investigate violations of the university's non-discrimination and or non-retaliation policies. And we have a new medicine bias reporting tool which can be used anonymously to report anything from one-time microaggressions to more severe behavior. So if you have any questions about these resources, you are welcome to contact me at domstaffhr@uw.edu. And then next slide, please. And then for staff, we have a thing called Core Competency Series. It was created to help employees understand where they fit into the department, because it can be confusing, and the greater university, and to provide a high-level overview of our core business areas. That would include education, research, finance, and some DEI topics. So our next one, mark your calendars, it'll be held Monday, June 14th at 1 p.m. And the topic is fostering a culture of respect and equity. And that'll be presented by Rashmi Sharma, who's an assistant professor in the Division of General Internal Medicine. And then last slide, please. Okay, finally, because it's Mental Health Awareness Month, and because this is much more important now than ever, I would say, I wanted to showcase the Whole You. If you're not already familiar with their site, this is a place to go for free virtual mindfulness, fitness classes, information and events based on topics such as eating well, becoming financially savvy, volunteerism, and a lot more. So next slide, and I'll hand it off to Mackenzie Keys, Communications Specialist, for an overview of the Communications and Web Service team.
Hi, thanks, Bryn. So I'm Mackenzie. I am the Communications Specialist for the Department of Medicine. I report to Amy, who had a conflict for this meeting. She's our Director of Communications. Our team also consists of our Web Services team, which is Will Sampson, our Manager of Web Services, and Alex Bonilla, who is our Web Developer. Next slide, please. Our Communications and Web Services team is responsible for creating and maintaining, creating and maintaining our department web framework. So all of our public websites that are affiliated with the Department of Medicine, so all of our divisions and affiliated programs. We also offer our services to other groups for a fee. Amy and I write and maintain content for all of our external websites, as well as our department-wide intranet, which is found at the link on the screen. We also create and disseminate a weekly newsletter for the department called Dom Week. It includes news, announcements, important dates, publications, everything really you need to know for in that week of the department. We welcome anyone to contact us with any sort of news that's going on, any new grants, new publications, honors, anything that you'd want to publicize on the website, or anything that you'd want to work with the media team. We work with UW Medicine and UW Upper Campus Media Relations. We also maintain a department-wide Twitter account, so you can follow us on Twitter. And yeah, so anything that has to do with web, news, press releases, our intranet and social media, you can give us a ring. I think that's it for us.
Great, thanks, Mackenzie. So now we have Walt Morrison, our IT director, and he'll introduce his team and provide us with some very important tips, tricks on how to be data safe. Oh, you're on mute, Walt.
I've been having problems with this all day. Hi, I'm the IT director for the Department of Medicine. Lincoln Reedy is our help desk manager. He'll handle any issues you have with your desktops or your mobile devices. Just a matter of calling the help desk and they'll get right on it. Dan Logic is one of our technicians. Jay Byrne is one of our technicians in charge of infrastructure. Micah Beard is a senior computer specialist. He handles all the infrastructure planning and implementation. Bill Dewey is one of our software engineers, and he works with the SharePoint system. Bill's getting ready to retire, and we are going to sorely miss him. But he's been a great asset for the department. Carrie Silverman is a software engineer, and she works in the SharePoint space too, and she'll help any of the divisions with any needs in the way of process control on SharePoint. Will Spangler is our senior computer specialist. He handles all the finance systems and programming, and does a lot of analytics for the financial group. David Chung is one of our help desk technicians, and he'll help you with whatever your needs are when you call the help desk. Next slide. So some of the things I'd like to talk about are when you come into the university and join the department, we have some pretty important things for you to remember. One of them is that when you're using your devices, they need to be password protected and encrypted so that we don't have to worry about any kind of data breaches from your devices. Any help you need in getting that done, our help desk can jump right on that for you. If you are working with your email and you wind up with suspicious email, things like misspelling or bad grammar or dead giveaways or stuff that you just didn't expect to get, or the offer is too good to be true, you should probably think about deleting that email. You should not open it unless you really understand what it's about. And for sure, when you're in it, you should not click on any links. It could be very bad. And if you do click the link, don't give anybody your password or your social security number or your credit card number or any of those things. Best to report it to IS Help and get it deleted off your machine. The next one is a concept called compute in place. And what this is about is a mindset to avoid taking your data with you, to use it and analyze it and work with it while it's in a safe place in the department's infrastructure and not on the road on your laptop or on your thumb drive like that. So if, heaven forbid, your laptop were to be lost or stolen, that data wouldn't be on that device, so we wouldn't have to worry about it causing a breach out in the world. We have several systems available to help you with remote access of the data. Desktop is familiar to most people. We can help you set that up. I think we have several other devices and systems like direct access and that type of thing that automatically get connected when you are offsite and you're working from home or whatever. If you have a DOM IT account, your this will automatically open VPN tunnel to your system and allow you to access your files and that type of thing. Files will still be on the department system and not on your local device. So we don't have to worry about any kind of issues with that. If you're working with your machine, for any reason it starts acting funny or you get threatening messages on it or anything like that, you should shut it down immediately and call the help desk. More than likely you've been infected with a virus or something like that. And the help desk can help you get that cleared off and get it rebuilt and run it again for you. A lot of people, when they come to the department, want to bring their own device. Your cell phone, your iPad, all of those types of devices, we can get them set up and get them configured to be secure, make sure that they're password protected and encrypted for you, and just make sure that everything you do with the data that you deal with while you're in the department is done safely, and make sure that we know that you need help. Just call us at 206-616-8805 and we'll help whoever calls. We have live technicians that take calls on the phones. You don't have to put in a ticket and hope somebody's going to call you back. When you call the help desk, you'll get through right away and we'll start helping you immediately. Let us know what we can do to help. We're here to support you in any way we can. Thank you.
Great. Thank you, Walt. Okay, next slide. So last but not least, we have our chair's office contact information here. You can contact Angie Bertolotti, who's the assistant to the chair, directly with questions, or utilize that DOM chair email and links to both our department site and our intranet. Next slide. Okay. Well, that's the end of our presentation, but let's open up for questions. You're welcome to put a question in the chat. And Chrissy, I'll ask you to monitor that if you could, or unmute and ask any question. I know there's got to be some questions out there. It's just got to be, especially about everything Walt just went over. No?
I have a question, Walt. When is Bill retiring? Like what date?
The end of July.
Okay.
But we're working really hard to find anything he's working on, understand it, so we can take over for him. You know, and
So can we go to
team up and help whoever needs help.
Okay, so we should go to Carrie Silverman now for SharePoint questions.
Or myself. Yeah,
Or-
either
okay.
one of us. Yep.
Cool.
Okay, anything else? Any questions for Karen Svensson, who will be retiring, and might as well put her on the spot one last time. Okay, if you think of any questions, just please, I know we gave you a lot of resources, but you can either email me or Chrissy at the DOM staff HR email, or again, Angie at the chair email.
And Bryn, it's recorded. Where will people be able to see this if they want to see it again for the information?
Yeah, so it'll be on our intranet site on the welcome tab. And Chrissy, would you mind copying and pasting that link to the chat?
Yeah.
So people can have that. And then within the next few days, yes, we'll have that posted. All right, thank you everyone. Appreciate it. Go enjoy the sun. It's beautiful out there. Bye.